Hi, I'm Tine. I'm a member of the Flemish patient organization for allergies and atopic dermatitis called Allergienet. I'm happy to be able to talk to you today about patients' needs. Thank you to the Eczema Foundation for this opportunity, even though I could not attend in person. To begin, I'll briefly introduce myself and our organization. So this is me. I've had AD symptoms since I was a baby. After a rather challenging childhood and an equally difficult student life, I'm happy to say that my eczema has diminished to a medium level. Since 12 years, I'm a volunteer with Allergienet. We advocate for patients, we bring patients and their family in contact with each other, and we provide information and support complementary to that of health professionals about living with AD, amongst others. Here are some of our projects. For AD, most worth mentioning are our thematic website and Facebook group. The annual event we do around the International Day of Atopic Dermatitis. We have also got a members newsletter and so on. So, onto patients' needs and the difficulties they face. This will be an open door for most of you, but of course it starts with a proper diagnosis and finding good information, brought in a comprehensive pace. Not only information about the medication or therapy prescribed, daily self-care and learning the routines are equally important, as you are aware. Since a consultation is rather limited in time, we're a firm believer in workshops about AD. Especially for children and their parents, but also for adults, which seems rather absent as far as we know. Patient education should not be limited to new patients, since there is quite some evolution in recent years. For us patients, it's a challenge to get help when you need it, and when that time comes, to accurately describe symptoms that happened in the meantime. Often it takes months to see a dermatologist. It would really help to communicate that patients can report a flare-up and get help sooner. At Allergienet, we're developing an app called Eczema that could support patients with this issue via a diary, a flare-up alert, amongst other things. It is undergoing patient testing right now, through our organization and through a study by the University Hospital of Ghent. There is a portion of patients for whom it takes effort to find a doctor that knows enough about AD to form the right diagnosis, take it seriously, and can offer help in a reasonable amount of time. This obviously leads to frustration. We see people in our Facebook group who are a bit desperate, are asking others to exchange names of dermatologists. So the rising knowledge and attention for the condition amongst health professionals is very important, so keep up this good work. Also, normalizing the condition of the patient is vital. Every person has a desire to be and to look normal, whatever that may be. AD has such a big impact on a psychological and social level, and patients with medium to severe eczema have a strong tendency to withdraw, either temporary or for longer periods, from their social life. We know that contact with other patients helps to overcome these thresholds or fears, but that is easier said than done, of course. For example, I haven't really met any other patients with AD until I was in my early 20s, and I wonder how different it would have been if I had known children like myself. So, organizing workshops where they can meet one another can be double beneficial, and/or refer new patients to a patient organization in your region. This psychological effect, the negative self-image and sensitivity to stress, definitely deserves more attention. I know this is another field of expertise, but realize that when you see a patient with severe AD in your practice, it might be the first real human contact he or she has had in some time. You might recognize the tendency to hide oneself or the sorrow in their eyes. I have always felt very relieved when my dermatologist said, I can see that you're having a hard time. So we will try this therapy, and if this doesn't work, we will try something else. So offer your patients some empathy, reassurance, and perspective, and they will be most grateful. It might even be a good idea to work together with a psychologist or refer your patients to one to learn to cope with stress and negative feelings. People with ADs need a lifelong and a holistic approach to care. Unfortunately, professional caregivers from primary to specialist care are often understaffed and under a lot of time pressure, which limits the amount of care that is possible. To give patients the attention they need and give them more control over their own care, we believe in the future of e-health applications, and we ourselves wish to contribute to that idea, as I told you earlier. That's all for me. I wish you a very pleasant and productive symposium. If you have questions, don't hesitate to contact a patient's organization in your area or maybe the umbrella organization Global Skin. Thank you.